Hi, and welcome to the Always Evolving podcast. I'm your host, Dr. Elizabeth Fedrick. While fluctuations in emotions such as irritability, mood swings, and difficulty concentrating are pretty common experiences, they can also actually be a signal of underlying health issues. And joining us today is Dr. Nicole Cain, a licensed naturopathic doctor. She's here to delve into the concept of preanemia and investigate its potential connection to emotional symptoms.
It's okay that we don't have it all figured out. We're all just taking it a day at a time. This is Always Evolving with Dr. Liz.
Hi, Dr. Nicole. Welcome to the Always Evolving podcast.
Thanks for having me.
Yes, thank you for being here. Before we jump in, tell everybody who you are, what you do, what you specialize in.
I'm Dr. Nicole Cain. I'm the author of the book Panic Proof, which will be published by Penguin Random House in October this year, 2024. My passion is to help people. My passion is to help people be free from anxiety and to actually heal using trauma-informed and holistic strategies.
And what type of, so you do medical work, what is your field of expertise?
My original training was in psychobiology, and I went on and got a master's in clinical psychology. And after that, I got my integrated medicine degree as a naturopathic doctor in Arizona. And so my practice is doing more writing and consulting. I'm not working with patients right now, but I love to provide education online and, of course, with my book coming out.
Yes, which is so needed. And that different approach is so necessary as well, of just looking at it holistically and, what else is going on, whether it's lifestyle or biological, genetic, what we're eating, how we're sleeping, all of that. So what we're talking about, though, today specifically is how some of these maybe emotional symptoms, experiences that we're having could be tied into maybe more biological or other type of ailments in that way. So tell us more about that.
I see it all the time and experienced it myself that when we feel anxious or depressed, oftentimes doctors will say, well, your best option is to get a counselor and to take an antidepressant. But we see that antidepressants only work 50% of the time. So they don't always beat placebo. And the reason for that is that not all of our symptoms are due to deficiency in serotonin. And so the power of the integrative approach is to look at the different root causes of why we feel the way we feel and to look at our symptoms as messengers about what needs healing and how, as opposed to the problems that we have to solve. And so today we're talking about iron, and iron is a really big part of that. And I'm particularly passionate about it because in women, we see with menstruation every single month and losing blood, that iron insufficiency is common. But a lot of times doctors don't test iron until it's so severely low that it shows up on the CBC. So I have many, many thousands of people that contact me after the fact, and they're so sick. And a lot of times this could have been prevented if they'd have just run a simple, easy to do, inexpensive blood test.
And what could people be looking for? Like how do we know, right? How do we know, is this because there is a serotonin deficiency? Is this because of my childhood trauma? Is this because I'm overwhelmed and burnt out? How do we know? Where do we start?
I teach people how to do a timeline. And so the timeline is one of the most important information gathering phases where you look at your history and every single moment of every single day since conception, arguably before, we've been adapting to what did or did not happen to us. And every adaptation has the opportunity to be helpful, or if we don't have the resources that we need, whether it's emotional support or nutrition or fresh air, whatever that is, those adaptations aren't necessarily always helpful. And so when you do the timeline, it can help us zero in, like, oh my gosh, I started my period, and then as I had consecutive menstrual cycles and lost blood, I started to notice that my fatigue was worse, my anxiety was worse. And so being able to zero in on your timeline and notice these keystone events, it can help us figure out what the next steps are to get to the bottom of why you feel the way you feel.
Okay, so it's starting to really understand how lifestyle, how previous events, all of that come into place of like, how is this coming into play in terms of where did this start? When did this shift happen? And then you can kind of pinpoint what might be the bigger concern. Are you also like running blood work simultaneously? Like that, I often send my clients to naturopathic doctors versus mainstream, which I'm open to both, think they serve purposes, for their own reasons. But specifically when I have a client who's been talking about symptoms of anxiety, depression, fatigue for an extended period of time, that is often what I recommend, is because with the naturopathic medicine, my personal experience is there's often like a full blood panel. There's a full like investigation, which we, don't often see with the Western. So is that kind of your approach as well, of like, okay, let's just really figure out what's going on?
I think of it as 3 tiers. And so tier 1 testing is just basic blood work that I think everybody should have. And I do include thyroid testing, like a full thyroid panel, including T3 and reverse T3. And I also always include a full iron panel that includes ferritin. And that helps reduce just this whole spray and pray test where people are going to these functional doctors and spending thousands of dollars. As we start at tier 1, if something shows up on tier 1 and we need more information, then we can go to tier 2, which is going to be more of like the hormone specific or the immune system. And if there's something abnormal there, then we could go to tier 3, which may be more like heavy metals and mold and much more of that deeper dive that may be excessive if it just turns out like, oh, your ferritin's less than 75. We need to clear this up first, see how you're doing, because that might be a really easy solution to why you feel the way you feel. In the example of iron.
Sure. So if somebody is, listening and they're like, yeah, fatigue is really something I've been experiencing, what do you suggest their first step would be? Like where to seek out that more of the functional doctor, or, where do you usually direct them? Especially, I assume you probably get like DMs or messages, emails like, help, what do I do?
I'm all about empowering people. And so if you have a resource that's your favorite resource to go to learn more about health, to learn more about the different causes of fatigue, I always encourage people empowerment first. And so get that education, because oftentimes our doctors are just so busy and taxed that they just aren't able to get everything in one visit. But for sure, when in doubt, make sure you're doing your annual blood work. And you can go in and order your own blood work without a doctor. There's lots of sites and resources now, like walkinlabs.com. And so when in doubt is just get those basic tier 1 labs. And then if there is something abnormal, then bring it to your doctor so that you can collaboratively create a solution.
Okay, I like that. So would be an empowering approach, that like you don't have to wait 6 weeks for the doctor's appointment. You don't have to like spend that time, the money, all of that. Just include this into your own investigation of what's going on. And if that is what is discovered, that there is that, maybe something going on in the blood work. So with iron specifically, where do people start with that?
Yeah, so let's say that their CBC is normal, and this is kind of like walking into a grocery store and they have at least one of everything that you need to buy. But what we want to do is we want to look at ferritin, which is more in reference to, let's say, the back stock, the extra milk that they have in the back of the store, so that if someone comes and buys it, that they can replace it. And so we really want to make sure with iron that we're looking at ferritin. And on the lab reference range, they say normal ferritin is 35 to 100, which doesn't actually look at optimal or normal ferritin. They made that number based on average ferritin. And so people are running around with pre-anemia or hypoferritinemia. And so if your ferritin is under 75 in the absence of inflammation, then you would figure out, well, why is that? Treat the root cause. But also, I always recommend supplementing, if your doctor endorses it, supplementing with iron to get those levels back up.
Sure. And from a just broader, if we were to just push out a little bit further, into your specialty of anxiety, what would be the top 3 things that you would tell everyone to do let's say maybe they're already doing counseling, maybe they're already seeing the psychiatrist, all of that. What are 3 things they can do to really support their nervous system and that stability?
Yeah, supporting the nervous system, the autonomic nervous system is always the name of the game. And so when we're having anxiety, it means that we're outside of our window of tolerance. And so the first thing that you can do right now is called the stoplight strategies. And so think of green light is when you feel really calm, you feel relaxed, you feel happy, you feel like yourself. And then write down everything that helps get you there. Self-care, food, supplements, whatever it is, write it down. And then the yellow light represents when your nervous system is getting a little bit agitated, overwhelmed, stressed, aroused. And then there are strategies for that. Oftentimes that has to do with working with the nervous system, whether it's using breath, inhaling for 4, exhaling for 6, and just repeating that. Or it could be stretching. It could be binaural beats, which you can do. YouTube has it. So there's lots of things for the yellow zone that you can use. And then the red zone is when we're in an actual crisis. So maybe a panic attack. And when you get into the red zone, you write down what is that like for you. And then we have DBT is really good resources for this. I go over all of this in my book, but they call it TIPS, which is an acronym to help us know temperature, smell, intensive muscle contracting and relaxation. And so those are strategies that are better for panic that go straight to the brainstem, as opposed to when you're trying to be logical in the red zone, that just doesn't work because that logical part of the brain is shut down. So number 1 is figure out your green, yellow, and red zone, and then create an action plan so that you know exactly what to do based on where you are.
Very good. Yeah. And from like a even supplement standpoint, are there any specific supplements that you suggest to assist with anxiety?
Yeah, it depends on the root cause of anxiety, but if we're thinking just like addressing and suppressing the anxiety, I love magnesium L-threonate. It's more readily able to cross the blood-brain barrier. I use theanine quite a lot for thought anxiety, which is one of the 9 types of anxiety. It's where our brain is mostly producing anxious thoughts, health thoughts, intrusive thoughts. If you have chest anxiety, I like to use things like kava kava, which is an herb, and it works best in the tincture form. So I use kava kava all the time. What's nice about kava kava is that it doesn't sedate the brain. So if you need to be on and you don't want to take a Xanax and be a zombie the rest of the day, kava kava has been studied in the literature to have the anxiolytic effects of benzos in certain doses without that kind of zombied out effect. So those are a few different supplements I like to use.
Great tips, great advice. I'm sure people are very grateful for that. I know that my clients frequently are asking, but like, what else can I do? So that's so helpful to add those tips. Thank you so much. Where can people find you? Where are you online?
You can find me at Instagram. I have a ton of information on whatever the heck is going on, whether it's the membership collective or the book or cool sales or things like that. My handle is at Dr. Nicole, Nicole, Cain, Cain.
Well, very good. Thank you again, Dr. Nicole. I really appreciate it.
It was a pleasure. Thanks for having me.
Absolutely. And thank you all for joining us on the Always Evolving podcast. We'd really appreciate if you'd rate, review, and subscribe to help us reach more listeners, and visit our website, www.evolvecounselingaz.com, to sign up for our newsletter, which is full of helpful mental health tips. And come hang out with us on Instagram at evolvecounselingaz.
This is Always Evolving with Dr. Liz.